on for.
All right. Hi, everybody. I'm so glad to have the opportunity to speak with you all. So my story is that I had been doing research on the topic of exercise and cancer for this, I guess, 16, 17 years. And then cancer entered my life personally. The woman that I had fallen in love with, she moved in to the house that I owned, and 3 weeks later, she was diagnosed with a stage 3 squamous cell carcinoma, very rare nasal cancer, and she ended up having a complete rhinectomy. Her whole nose was removed, and a lot of skin grafts from forehead and forearm, and 5 reconstructive surgeries and combined chemo and radiation. And that experience really changed me, changed her certainly too, but changed me in the way that I talk to people about exercise and cancer. I used to talk about the evidence, and I'd say, well, 20% chance of changing this and a 30% improvement in that. Those data are still useful and still relevant for you all. But now I can't help but see the reality and the human beings behind these diagnoses. And something happened in the process of caring for my Sarah, who's now my wife. And one of the things that happened is, I kind of freaked out. We just kind of went on kind of freak out mode for a little while, and sometime while she was going through the combined chemo and radiation, she said something about, my God, I'm just so tired. I'm so fatigued. And I had a moment of like, wait, I know something about that. Wait, I can help with that. I can help. And I got her started on a program immediately. And then I felt terrible because I felt like I'd missed this whole window of rehabilitation. And, we missed opportunities to build her lean mass. And, she was suffering more than she needed to have suffered at that point, because I had kind of forgotten that I could be helpful. And I thought, how are we going to get the word out? This is, at this point, you all know that there's over 1,000 clinical trials that have been done in the area of exercise and cancer. We have really pristine evidence that tells us that exercise is not just safe, but is really actually quite useful all the way through the cancer experience, even when you're feeling it at your worst. And yet it's not happening. And so the question that I was asking is, well, how do we change that? And I thought, well, how about a popular press book? What if I told my story, told Sarah's story, and she helped write sections of this, so it's her book too. And so that's why the book exists. So what I wanted to talk to you all about today was kind of 2 things. I wanted to talk to you about the evidence base, but then I want to talk to you about the secret sauce with exercise and what the secret sauce is. And then I want to take questions from you guys. So the evidence base. So this big team, like 40 scientists and clinicians, came together in 2018 and under the auspices of the American College of Sports Medicine to review the evidence base to say, well, is exercise associated with incidence of cancer? The answer is yes, for about 8 different cancers. There's about a 10 to 20% reduced likelihood of onset of cancer for breast and colon and endometrial, bladder, esophageal. There are a number of different cancers for which exercise does reduce incidence. There's also really strong evidence that exercise is associated with reduced risk of recurrence or mortality for 3 specific common cancers: breast, colon, and prostate cancers. For breast cancer in particular, it's worth noting that the risk of overall mortality among breast cancer survivors is 41% lower for people who are adequately physically active. That's not to be sneezed at. That's substantive. It's similar, but not quite as large for prostate cancer, and it's actually about the same for colon cancer. And so there is a very specific exercise prescription that's recommended when we're talking about trying to reduce risk of mortality from cancer. That is 150 to 300 minutes a week of aerobic activity and twice weekly strength training. You can build up to that over time. If you don't have that amount of time, you can do vigorous exercise, 75 to 150 minutes a week. And one of the questions that gets asked a lot is, yeah, but what about my cancer? Because I didn't list your cancer, perhaps. And it's not a situation where we think the other cancers don't enjoy the same benefit. It's that the studies haven't been done. So we actually believe that exercise probably has a strong benefit for reducing cancer mortality for most types of cancer. When it comes to side effects and symptoms as you're going through your cancer treatment and soon thereafter, we know that exercise has a substantive benefit for anxiety and depression, breast cancer-related lymphedema, physical function, which is to say your ability to stand up and sit down, get on the floor and get back up, carry a case of water into your house, climb a mountain, all of the things that you might want to do physically. We know that exercise is good for quality of life, which probably means something different to you now than it did before your diagnosis. We know that exercise has substantive benefits for bone health after cancer, as well as sleep quality. There are a number of things that are still being studied. One of them that we have promising evidence for, but we're not quite sure about yet, is the ability of cancer patients to complete their chemotherapy as it's originally prescribed, which is important. It turns out that getting less than 85% of what was originally prescribed has a survival decrement associated. So if you have to take chemo holidays or delay things or get less of the chemo than what was originally prescribed, that's actually not great news. So those are some of the benefits that exist, and I'm hoping that you'll ask me, fatigue. Let's say fatigue. The most well-established benefit is about fatigue. There are a number of other benefits of exercise that are probably of particular interest to you all that are not cancer specific, but they are probably specifically important in people who've had cancer. And that is that exercise has strong benefits for a number of comorbidities. So it might be that you have more difficulty with your diabetes or your lipid issues or your hypertension after a diagnosis of cancer, and exercise is helpful for those. We know that exercise reverses and prevents frailty. We know that exercise improves body composition, meaning that it will increase lean mass, muscle mass, and decrease fat mass, even without changing body composition, without changing BMI, interestingly. So you can trade muscle for fat with exercise. We know that exercise has an effect on inflammation. This can be extremely important for fatigue. It can be important for immune function. So there are a number of things that exercise does that are non-specific to cancer that are quite specifically helpful in a human being who happens to have had cancer. And now I want to talk about the secret sauce for a little bit, and then I want to take the questions. So what I mean by the secret sauce is I write about this in the book, but I think it bears repeating. If you drive your car once a month and um, you, you hear a rattle in the car, you don't know if it's new. You just know it's a rattle. So you can go to the filling station, the service station, and say, hey, there's a rattle in the car. And the guy at the service station will say, is it new? And you can say, no, just hear a rattle. And they can go, huh. And they don't really know what to do with it. They might drive it and go, but they don't know how to treat it. They don't know how to do anything with it. But if you drive your car every day and there's a new rattle in your car, you can go to the service station and say, there's a new rattle in my car. It goes like this. And, car guys, anybody remember the car guy? It goes, and they say, oh, I think that might be the carburetor or whatever they'll say it is. Okay, that's new. That's a new thing. All right, let's treat that. Let's do something about it. The analogy is that if you exercise often, maybe not every day, but maybe every day, and you notice how your body works. You go on a walk one day and you walk 3 miles, and you walk 3 miles and you feel like, ooh, I'm good. You get up the next day and you go for a walk and you get, half a mile out and you're like, nope, it's not happening today. And the next day you go out and you're still not okay. You know something. You know something that you need to tell your doctor. Understand the analogy? If you are able to know what your body is doing and how it is changing as you're going through treatment and afterwards, then that's information you can give your doctor that allows your doctor to treat your cancer better and handle your symptoms better. The other way of putting it is, think about the difference between an Olympic athlete who knows their body extremely well and the average couch potato. The person who's an Olympic athlete really understands every symptom. They understand what's happening in their body, and so they're able to tell their coach, something just doesn't feel right in my right ankle. I don't know, it's squishy, right? So they take a look at the ankle and they image it and they treat it and they learn something and they trust the information from that athlete, because that athlete has been finely honing what's happening with that instrument of their body for a very long time. You have the capacity to have that sort of power with your disease team. You can take good care of your instrument, and then when you feel that something has changed, you can report that in as a change. And that is powerful. That is a powerful and very different report than, oh yeah, there's a rattle, but I don't know if it's new. I hope that makes sense. And I think that that is an extremely empowering reason to be more physically active on a regular basis as someone who has dealt with cancer. So there we go. There's a few words, and we can go back to where I can see everybody's face. Hopefully, I can answer a few questions.